COIN, Community-Oriented Integration Network, is a network of friends, people of experience, who explore how to develop local communities for health, compassionate communities. One of the problems we encounter when different people are working together, let's say with carers and people who are ill at home, is that everyone is thinking differently about what the work is. At one level, this is pretty useful because different people contribute things, but you also need to have some kind of shared agenda or shared vision or shared hope for the situation. And if you think wildly different, that doesn't help. Now, Julian Tudor Hart put this very well in his book, A New Kind of Doctor, where he said that medicine's adoption of the laboratory-style research that looks at things one at a time as though under a microscope, whilst very useful to understand the behaviour of, let's say, antibiotics on diseases, doesn't say much about the whole human condition. And he says that not only are they deceiving the public with this atomized view of the world, but they've deceived themselves as well. So a new thinking is emerging about what is it to be a health and care practitioner in a world where we're not seeing everything as parts of a machine, but as joined up in a organic, holistic kind of way. Fritjof Capra says something about the science of this. In his multiple books, he's a most magnificent writer. This one is called The Web of Life. He describes how science, modern day physics, shows that everything is connected, and indeed everything is interacting with everything else. So what you see when you think something is still is slow movement. The reality is that living life forwards, everything is adapting to changes in everything else. Now, this is not a new idea, but it's quite a difficult one for people to come to terms with. 200 years ago, Kierkegaard said, most people mistake the certainty of life already lived, looking over your shoulder, with the uncertain and co-evolving nature of life living life forward. Well, actually, Darwin said something very similar as well when he said that the theory of evolution is everything is adapting to changes in their environment. And this is why the giraffe survived, because it was able to reach the leaves that other animals couldn't reach. It isn't all through force, and it isn't all predictable. Well, that idea of the messy, complex nature of living life forward and the certainty lived with hindsight is a very discomforting process when people feel themselves in an uncertain situation, because we like to feel that things are controlled. How do you manage this in reality? And part of this comes down to, what is health anyway? Health, as Seathouse said, is the foundation for achievement. Antonovsky said health is overcoming adversity. In a way, health is whatever it is that helps you to live life in a positive way. I like to think of health as I am the lead actor in the feature film of my life and the co-actor in the feature film of the lives of many others. And I put this idea forward in my book, Integrating Primary Health Care. So we're very familiar in medicine with the idea of biopsychosocial aspects of health. And you can make sense of that in terms of what I'm saying, that if health is whatever helps me to live a meaningful life story, if my legs aren't working, I can't walk on the journey, and psycho, if I don't have the mental capacity to be able to do it, I can't, and social too, if I don't have friends or a sense of the area, I can't do it. But there are many other aspects as well that aren't adequately covered in the biopsychosocial list. And I particularly want to pick out environmental and spiritual. Because if the environment that I'm in does not allow me to make a journey, let's say I'm being bombed, or the road is full of potholes, or I'm being shot or harmed at for wherever I go, I also can't travel on that journey. And spiritual, if I don't have a sense of being grounded in the earth and a sense of my belief in my own self and a vague sense of my ethical system and where I'm going, I too will find journeying very, very difficult. So one of the aspects that we need to work on by getting people to collaborate for health and care at local level is the idea of bio, psycho, social, spiritual, environmental aspects of health, and helping all involved to appreciate that they're helping people to live healthy, meaningful journeys. Now, this is very obvious when you're in a crisis. When everything is hunky-dory, then it can feel as though this is all academic words that doesn't really matter too much. But you bring a crisis like war or end of life, and suddenly it becomes dramatically obvious that all these aspects matter. And also you need the people with different aspects and different ideas and different perspectives to come together. So that's why it seems to me that end-of-life care and care for carers, but especially at end-of-life care, is one of the most valuable places to understand how to live in a healthy way, because it helps you to appreciate what matters. And what matters is a healthy life story, the beginnings, the middles and ends, that life is constantly evolving, that things are not simple and static, but movement. And that we can make that movement make sense by including people in the stories, reflecting on their past, being mindful in the present, and taking steps into the future that make sense to them in whatever context.